advocating for your health, practicing resilience through preventive healthcare during COVID-19. And just really quickly, I want everyone on our team to unmute themselves and introduce who you are. So we'll go from left to right. So Marissa, you're first.
Good morning, everyone. I am Marissa Adams, the program coordinator for the project.
I'm Julie Arman, and I'm in the Department of Family and Community Medicine and affiliated with the Sonora and UCID at the University of Arizona.
Hello, good morning. My name is Veronica Boone. I am with the Tucson Indian Center, and I am the Wellness Director. Thank you.
Good morning, folks. My name is Dana Russell. I'm with the Hopi Cancer Support Services Program in Kikotsmobile, Arizona.
And I'm Heather Williamson, and I'm at NAU. And this project is funded by the Partnership for Native American Cancer Prevention. So we have that listed there with their logo. And I also would like to acknowledge some people in the room, Kim Russell and Betty John, who are on our advisory board for this project. I saw your names in there. Thanks for being here. And also one of our students, her name is Bailey, is also joined. So thank you for joining us. So our objectives for today is we're first going to briefly talk about how COVID-19 has impacted access to healthcare, and how we can think about that in ways in which you can advocate for preventive healthcare services. And we're gonna, this session, part of this session is we're hoping to be very interactive because we're actually going to walk you through, our project team is developing a health education program for American Indian women with disabilities to advocate for their health, specifically to get required and desired cancer screenings that they'd like to receive. So you'll see later on, we're going to actually walk you through practicing some skills of self-advocacy for your health through some activities. And we're going to talk about the importance of being resilient and advocating for your health to get the preventive healthcare services that you'd like. So as we all know, people with disabilities have had some experiences with COVID-19 that have been very challenging. Overall, people with disabilities have experienced poorer health outcomes compared to those without disabilities. We also know that, of course, people have lost access to support services, which for some people with disabilities are really, really important and helpful for them when they want to access healthcare. And then, of course, we've all experienced anxiety and mental health concerns. And then for some people with disabilities, this is related to losing their jobs and experiencing social isolation. And then the vaccine itself, it's here, and some people really want to get it, and we know it's not always as easy to access, and that people with disabilities are not considered a priority population necessarily in all areas of Arizona to get the vaccine.
Well, folks, as we all know now, things are not always the way it used to be. And of course, that's no exception in the accessing healthcare at your location. There are certainly, you're familiar with having to wear a mask when you access a facility. There are extra precautions that are required to get into a building and see your provider. And at times, even the healthcare provider may not allow more than one person, the patient, into the exam room as well. So what this generally can cause is that it make people hesitant to go for their preventive health care. Rather, they would maybe just go if they're really, really ill or sick. So those are some consequences of not having proper access.
So, in talking about preventative healthcare, what can we do to preventative? We're going to take a little poll, or if you could add your comments, thoughts, examples in the chat box. And what we're looking for is what are some examples or instances of preventative healthcare, preventive healthcare. And I'll give everyone a minute.
Yes, I'm sorry, I didn't catch that. What did you say?
In the chat box, if you could put some examples of preventive healthcare.
Okay, so I'm seeing people typing in getting dental appointments, eye appointments, well woman checks, physicals, general medical screenings. Yeah, and also at eating, exercising, wearing a mask, going for blood work. Yes, all excellent examples of what would be considered preventive healthcare that people could be participating in.
Thank you. I also see eating fresh, nutritious food. It looks like everybody has some good examples.
Mhm.
Other things, like as was already mentioned, is getting your teeth cleaned. Again, that's preventive healthcare. Going to a doctor for a checkup, your annual exam, to see how you're doing physically. Getting a pap test for females, and the pap test checks for cancer in people with female parts. So again, thank you for all of the examples, and I apologize. Sometimes my fan is going on with the cooler in my building, so sometimes hard for me to be heard. But if there's any questions or if you can't hear me, please let us know in the chat box. Thank you.
Let's see. Obviously, if many of you have been to the doctor or to your clinic, whether it be a private provider or Indian Health Service, you've noticed that there can be difficulties that maybe were not there before. And it can be as simple as processing your paperwork. And of course, that makes your experience more difficult. But obviously, we all understand that the situation with the pandemic is the cause for a lot of these disruptions. Here in Hopi, we have our cancer screening program, and we haven't been able to provide breast cancer screenings as we have before, just because of the uh, uh, disruptions that have occurred, closures and such. So we're all familiar with that.
In addition to that, this is Veronica with the Tucson Indian Center. And just to clarify, we don't serve like one tribe. We serve all of the urban American Indians and Alaska Natives in the metropolitan Tucson area. So what that means is that we do see a lot of our clients who are on the Access Plan, but that's where they get a majority of their care. So during this time of the pandemic, we've seen a lot of providers who were not seeing clients, or they would kind of push, let them know that they're not seeing people. And I can think of a clear example, dental services. And people are saying that because of the aeration with the dental services, that we just curtailed and we can't get any dental services from the local Indian clinic unless it's an emergency. So even if it's an emergency, say you're here in Tucson, you have to go to another dental clinic that is an Indian health provider. You're looking at 65 to 100 miles away. So if it's an emergency, instead that people are being told, okay, it's an emergency, I'm going to find transportation. So a lot on our clients to have them go and get services. So once they're there, they might be told that, you know what, we're just going to pull your teeth. So, for example, that's not something that a lot of people would like to happen. They'd like to keep their teeth. So if they have limited services during the time of the pandemic, it is, my question would be, are they really getting the care that they're requesting? Are they getting the care that, helps preserve their self-esteem? And then I think for Native people, I was thinking that we're used to getting told no quite often. So no, you can't do that. No, we don't provide those services. But what I would hope for is that one day we have calm people that they can say, okay, I hear you say no, that you can't help me with my autism, for example. Can you refer me to somewhere, another provider that is able to provide the service? So again, with the pandemic and just with the nature of how things are right now, again, this is one example of a disruption in healthcare and it's just emergency services. Thank you.
And we know, so our project is focused on cancer screening, and we know that COVID-19 caused changes in cancer screening rates. So there was a hospital in the northeastern part of the United States that looked at the number of patients screened at the start of the pandemic, and you can see that it's the little red square here. You can see that at the start of the pandemic, the first 3 months of the pandemic, they screened half of the number of patients who they would have seen under normal circumstances, so the previous year. So we know that the pandemic has affected people's use of healthcare. And so, as Heather mentioned, today we're really going to focus on PAP tests. So that's a screening test for women, and we'd like to walk you through an activity to get you thinking about how to advocate for screenings like a PAP test. And these ideas can be used for many other conversations with your doctor and with support people. And so what this image shows is that, you know, the PAP test is an exam that a woman might get every few years after they turn 21 years old. But there are other screening tests that everyone would receive regardless of gender. There are, for instance, once someone turns 50, they might get screened. It's recommended that they get screened for colon cancer. That's the image on the left. And on the right shows some information about oral cancer, which is something that your dentist ideally screens for when you go in for a visit. And so we just wanted to highlight that the activities that we're doing today are really applicable to different types of preventive healthcare, including cancer screenings. So the plan for the rest of the session is that we're going to walk you through an activity. First, we'll kind of set an agreement for sharing our ideas and thoughts, and then Heather's going to lead us through a relaxation practice, and then we'll talk about self-advocacy and how you do it, and brainstorm some ideas to discuss with family members and support people, and then leave you with a job after you sign off of this session today, focused on relaxation.
Okay, so as Julie mentioned, you know, kind of imagine we were actually in a room together, right? And here we are in this room, and we're going to talk about getting cancer screenings. And so for some people, that might feel really natural and fine, and for other people, maybe they're a little nervous about that discussion, or maybe they don't feel as comfortable. So what are some ground rules that we might want to put out there for ourselves to make sure everyone feels comfortable and invited to be part of the conversation? And if you have ideas, place them in the chat. And I'll start with one. Be open-minded. Yeah, don't be afraid to speak up. That's one I just put in there. Other ideas from people? Don't judge. Yep. We all have different places we're coming from, right? So be open-minded to other people's ideas. Yeah, keep things private, right? So maybe things we talk about here, we don't want to share outside the group. Be respectful of people's cultural beliefs about specific topics. Be respectful. Maybe some people want let you do this by letter or email. They don't want to talk. That's fine too. Understanding the effort is a community-wide and supports the overall health of the community. A life saved is a bonus to the overall community. That's a very important thing to keep in mind. Like, why are we talking about this? Why do we talk about cancer screenings? Excellent. Julie, in the sake of time, do you want to move on to the next slide? Okay, so I'm going to briefly take us through, and as we saw, some people may be a little nervous about this, and so we're going to practice a relaxation exercise. And this relaxation is really just about deep breathing. And sometimes, if you take the time to take a deep breath, it can really help you feel calm and ready. And so I'm going to use a tissue to kind of show you that I am taking deep breaths, so we can practice doing that ourselves. So if I'm not taking deep breaths, you can see the tissue's moving a lot, right? It's jumping around. But if I'm taking a deep breath, I breathe in. I breathe in. So you can see how the tissue kind of stayed out there longer. So if we all could take a deep breath in and breathe out and breathe in and breathe out. So this is something we can practice for ourselves. If we're going to our doctor's visit, or we're going into something that maybe we feel a little anxious about, that's something you can do sitting in a chair in a waiting room while you're waiting for that appointment. And I know for me, when I take those deep breaths, it helps me relax. And yes, you do this before blood work. Absolutely. When things are making you nervous, take time. Yeah, take time for yourself. Excellent.
So one important concept to remember when we're talking about preventative healthcare and getting screening is learning about what is self-advocacy and how do you do it, right? We want to make a plan, and we want to practice talking with our healthcare providers, as we had mentioned before. And when we're thinking about scheduling a preventative screening, we want to think of a plan. So today we're going to do an activity with you. We're going to make a plan of things that I need to know right now and things that I need to do. So when I say I, you can say things that you need to do and things that you need to know. So this activity can be done virtually using Google Jamboard, and the link is going to be put in the chat box. So we all can click on the link Heather has shared with you.
Hopefully people are seeing that on the screen. So on the left, it says, here are things I need to know. And on the right are things I need to do. And we've put some, thinking about a woman going for a PAP test specifically. Some of these things are on these Post-it notes. And once you're in there and I see some, anonymous Google creatures have joined. And so some of you are in there. You can actually move those Post-it notes around. So what are some things that you need to know versus things you need to do? Mm-hmm.
Perfect.
Mm-hmm. Y'all are doing great.
Mm-hmm. Awesome. So I think we have them all situated now. So things we need to know, what a PAP test is. That's good to know, right? Before you go in, we don't want to go in there blindsided. And how often to get a PAP test, why getting a PAP test is important. Who can help me get a PAP test, which is, I think, a really important one. And then things I need to do, get a ride. Public transportation is sometimes a barrier if we don't have our own vehicle. I'm getting a PAP test when I turn 21 years old. Perfect. Ask a friend or family member to go with me, and practice relaxation techniques during the PAP test. Those are all really good things. So we are. So practicing talking to a healthcare provider is super helpful if it's your first time scheduling your appointment. You want to get your PAP test, but you have a lot of questions that you want to ask your healthcare provider. You also know that you may want a family member, friend, or a caregiver to join you at the appointment. So you ask your healthcare provider about getting a PAP test, but the healthcare provider tells you that since you have a disability that you don't need to get the PAP test. What would you do? And you can put your ideas in the chat. Yes, knowing about your family health history is important. But what would you do if your healthcare provider told you that because you had a disability, you don't need a pap test? How would you respond to them? I would inform them that despite the disability does not negate the health risks that the health screening helps prevent. Perfect. I love that answer. Thank you, Thor. Explain calmly that actually having a disability doesn't mean I don't need a pap test. Thank you, Bailey. Perfect. I would ask if I can have an advocate to help me express the importance of looking after your own health. Get a different provider. Thank you, Sue. I think you're right. It is asking to those who think that people with disabilities don't need sex education. They do still have feelings and need to understand the challenges, the process, and how to protect, advocate for themselves. So you are right. And then Bessie, ask for a nurse to help you. The disability has nothing to do with the visit. Thank you so much for those. Those are all wonderful, wonderful, wonderful things. And we definitely want to do all the above.
Shall I move forward, Marissa?
Yeah. Thank you.
Thank you. So as Marissa discussed with you all, it's important to have good communication with our physicians so we can understand the right information about our health and talk with our family or staff when we need to go to the doctor. So before you even go to the doctor, it's important to speak with others about your health and the importance of preventive health care, and express your feelings about getting good health care and taking care of your health. And hopefully those others who support you will be supportive of you making an appointment and going with you if you want. And as you all mentioned, it's important to talk with the doctor about your health concerns and speak up. And communication can sometimes be tricky, especially in a fast-moving doctor's appointment. So it's good to be clear with your doctor about what information you want and need to know, and what you want your doctor to know about your body. And hopefully the doctor will be clear with you so you can understand that information correctly. And so are we doing the Google Jamboard activity again?
I have it in the box if you want to do that. Yep.
Okay, perfect. Let me stop. I'm not so great at multitasking. Minute. There we go.
So I think I just put the link to a new Jamboard in there. Some people have joined. So what are things that you could brainstorm, questions you could ask your doctor or your nurse? And in this case, you click on this little button here and create a sticky note. I'm just going to show you what it looks like. Now my sticky note is in there. So you can use that sticky note option and write up your own questions you might ask your doctor or nurse. I'll delete my test. My healthy weight.
Thor mentioned that many medical offices don't always realize that appointments with people with disabilities take a little longer than typical appointments, and they need to be patient.
Mm-hmm.
So good question. Will my doctor be a female? That's a reasonable question to ask. Am I at a healthy weight? And Thor, to your point, I've read some advice that suggests that if you do need additional accommodations, calling your doctor's office in advance and asking for that, and letting them know that you might need a little bit more time. They might be able to accommodate you. What blood work will I need and how often? Good questions. How often do I need certain procedures? Exactly, a colonoscopy, pap smear. Oh, do you have telehealth? That's an important question. Will you follow up with any health concerns? Great question. Great questions, because sometimes that is not clear when you leave the doctor's office, whether the doctor is going to follow up with you or if you need to follow up with them. Will this be painful for me? A reasonable question, and the doctor can explain to you what you should expect. Will you help me if I get nervous during a screening or an exam? Another really good question. Can you explain in terms that I understand? That's a wonderful question, and a reasonable question that you can interrupt your healthcare provider to ask if they start throwing a lot of technical language at you. Are there side effects I need to know about? That's a question that came up in the chat. So in the interest of, these are all great questions. Thank you so much for participating. And in the interest of time, I'm going to pull our slideshow back up and we'll move to the next activity, which is another brainstorm activity. And as Heather mentioned, and others, and Marissa, for some women, getting cancer screenings can be uncomfortable and embarrassing. And so we want to think about, we want to kind of brainstorm with you and interaction. So we are thinking, we want to think about a woman who just found out that she needs to get a pap test, and she is a little uncomfortable and embarrassed about it. And we want to think about how the support person her support person might provide information and ask questions to help her decide whether she wants to go for the screening now or later, who she wants to go get screened by. And so we're going to do another Google Jamboard, and you can share your thoughts. I'm going to stop sharing. So the idea is that, go ahead.
I would say for those that don't feel comfortable in Jamboard, the chat also works fine too. Just want to make sure people know that we're tracking both. Sorry, Julie, I interrupted you.
No problem. So maybe for this activity, it might make sense to think about this from the perspective of the support person. What information could you provide to your friend, loved one, family member about their concern or about the test? And what questions could you ask your friend, loved one, family member in order to kind of support her in making a decision? Great. Contessa mentioned in the chat, explain why it's important to have this test done. And someone put a question in on the Jamboard, can my support person go with me? Great question to ask. Explain the process. So the support person could explain the process and what is involved so that the woman knows in advance. Jessica put in the chat, ask her how she feels about it to get a better understanding. Yep, someone explained that it would be best to walk through each step of the process so she knows exactly what's going to happen. I can't see the small type. I'm looking. Can you read the small one? There you go, Heather. Thank you. I would tell a loved one that it's okay to express boundaries with the provider and that they can stop the appointment at any time if they become uncomfortable. Yeah. Another good question that the woman might be asking the support person, can I fill out the paperwork myself? Maybe they would like assistance filling out the paperwork from the support person. You could ask the woman if she would prefer a female doctor. And Lee, great comment in the chat. Explain the next steps for women and men if they're informed that the tests come back positive. That's a really important next step. And then Jessica, you had another comment. So the support person could give information or suggest that they call a nurse over the phone to explain. Yep. And Destiny commented that the support person might ask if the woman wants them to be in the room with them. Great input. I am going to move us back to the presentation and turn it over to, I think that Dana and Veronica are going to be speaking.
Okay, as we discuss health and some of these issues that have been brought out, invariably we get to the topic of traditional healing and versus possibly Western medicine. Many natives have strong beliefs in tradition, and traditional healing falls into that. The major differences in the two would be that traditional healing affects the entire being and all parts of our health, as opposed to Western medicine focuses on the body, the whole body, healed body of physical symptoms and disease. So those are issues that quite often come up, and maybe some people may be confused, but I guess the whole point here is that they work together to provide what is needed for a patient.
I would also add that here at the Tucson Indian Center, we do sometimes get requests for traditional healing. And I know it depends almost like on what area or what entity you're asking. For example, in my homeland, on the Navajo reservation, for example, they have traditional practitioners that is covered by the health insurance there, usually through access. But again, they have resources, they have people that they trust and built relationships with, so that if a patient ever feels that, again, it's almost like working together with Western medicine and then traditional healing. So in the case if someone were to ask for traditional healing here at the Tucson Indian Center, we work with the local tribes and refer them to their health departments, so that because the tribes know their healers, they know I don't know if they have a contract or anything like that, but they have working relationships with the traditional healers for the local tribe. And if say like a person is here in Tucson, maybe from like the Navajo reservation, they're here in Tucson, we can also reach out to the Navajo area office, or the Navajo office closed, to see if there's information that we can provide to the client here. And then also what are the processes that they need to do in order to get the services while they're living here in Tucson. So it's not uncommon, but we do sometimes get that question as to provide traditional healing.
When there are questions that arise in your mind about your visits and your health, especially particular about these topics, you might want to, don't be afraid to ask questions. It's the only way you're going to get answers to the doubts or questions that are in your mind. And here are some examples, like can you work with your traditional healer during the time of your treatment? And how can you practice traditional healing in the clinic? Those are, if they're important to you, then you need answers to address those questions.
So I think, oh, sorry, is this you, Veronica, or is this me?
Go ahead. I think I'm breaking up. So go ahead.
Oh, okay. Oh, yeah. So this is this is what we call kind of like your homework, right? Or in this case, we're calling it your job for your health. So really practicing saying something nice to yourself when you go to the doctor, right? It's important. Write down any questions that you may have ahead of time. I know for me, when I'm nervous, it helps me to have things written down so I don't forget to ask something in that moment. And so maybe those things we practice today, you can make some notes to yourself about the things you want to make sure you ask your doctor. And also, to the last part of our talk, if traditional healing is very important to you, be prepared to talk to your doctor about that and making sure that they know that's a priority for you. And there was a question, so I just want to, there's a couple comments, and Lee, I saw that you noted that the Tribal Voc Rehab Program can cover costs for using traditional healers to prepare tribal members with disabilities for employment, which is fantastic. And Thor, you made a question, how consistently does the local Western medicine-based hospital support traditional healing practices without judgment, criticism, or bias? I don't know if anyone has a thought on that you want to speak to on our group.
I know that the different tribal or the different healthcares that are on tribal lands do support that, and they do have, most of them have a listing of traditional healers that they are working with. But on that note, I think it's really important to remind everyone that when you are working with a traditional healer, that it's important that you let your Western medicine team know, because sometimes we found out through working with patients that if you're working with a traditional healer and you're using traditional herbs, it doesn't necessarily mix well with the Western medicine. So that's really important to share that information both ways.
So I think we're wrapping up, and Heather put a thank you all for attending, and we're available for discussion and questions and thoughts. Heather put a link in the chat to a short, we promise a very short survey about this session to get your feedback. We are developing a program, and so we're really interested in your input about this session and any thoughts that you have about better supporting Native American women with disabilities and getting the health care they deserve. I'm going to stop sharing my screen.
Yeah. And I think people can either put things in the chat. I think participants can unmute themselves and speak.
Yes.
Okay. Okay.
I think you can. So if you want to unmute yourself and speak, feel free, or you can put thoughts or questions in the chat. We really appreciate all of the chats that we've gotten during this discussion.
Thank you so much, everybody, too, also for being so for being good participants. It's been really helpful, and your ideas have been are really been very great for us to consider as we're developing our program. Kim, I saw you Jessica put in the chat, when they screen you, asked the question if you are taking any herbal traditional medicine. Good to know. And then Kim put in there Access. So for those that don't live in Arizona, Access is our Medicaid program. And Access has submitted a waiver to reimburse traditional healer services for providers at, I think it's supposed to be IHS. I know it autocorrects that for me a lot, Kim. Indian Health Services and other tribal facilities where people go for health care. Yeah. Which is great.
Thank you, everybody.
And thank you so much for being patient while we were trying to get everything together. These Zoom things don't always go as swiftly, right? And then, yes, and then Julie put in there again, the survey link, and I will just tell you, it's a very brief, just a few questions. We really would appreciate any feedback you could give us. Very, very much so. Thank you. We'll hang out and yep.
Yeah, and thank you to the organizers. Laura, I just want to echo your thanks for providing ASL interpretation and Spanish interpretation and captioning. Thumbs up.